welcome to H2O Stream. My name is Sean and I'm the editor at H2O Global News, and today I'm joined by Andrew Engeli, Chief Strategy Officer at Kando. Andrew, it's great to have you.
Thanks. It's a real pleasure to be here.
Fantastic. So I think before we shoot off into the conversation and get stuck into it, a great start would be if we could just find out a little bit more about you and your role at Kando. What is it that you do on a daily basis?
Yeah, thanks. So I was brought into Kando in June of 2022. I came in as at that point as the VP for Community Health Strategy and Services. And I came into Kando in that role because I had been working in the pandemic response for the UK government, and I'd had a prominent role in leading the UK response to the COVID pandemic. And so coming into Kando, I initially had the portfolio of expanding our community health offering and providing strategic direction there. And since that, I've taken on the role of Chief Strategy Officer for the company more generally. And so there, in my day-to-day job, I look at developing our strategic positioning in the marketplace, look at over-the-horizon sort of market activity, and I liaise very closely with our innovation, our R&D, and our business development teams to ensure that we've got, so the next best thing in our product pipeline.
Okay, that's great. It's exciting and it's really valuable, I'm sure, to come from that background, also working with the government at the edge of the pandemic, at the forefront of that, and I think that really fits into your role now. I mean, me personally, I first heard about Kando because you were doing really groundbreaking work in detecting COVID-19 in wastewater, which was kind of a world first at that time. So, I mean, just to lead from there, do you think this has made policymakers and businesses value wastewater more than pre-pandemic?
I love that question. I really like the question, and I think it really touches on something that's incredibly important. I think when you think about wastewater, most of us know somewhere that actually our sewer systems began as a public health resource back in the days of Jon Snow and all of that in London. But, since then, I think we've sort of forgotten about them. In a way, our wastewater systems are kind of the forgotten infrastructure of our modern societies. And what the pandemic did is it really brought into sharp focus, not just sort of the challenges that wastewater and sewer systems pose to our societies, but also the promise that they hold for us. So what we were able to show in the pandemic, and as you said, the work that Kando did in Israel has been absolutely fantastic and groundbreaking. What we're able to show is that, in the sewer system, there's this tremendous source of data that, taken properly and analyzed properly, can really help, public health authorities, governments, businesses, better deal with the kind of public health challenges that we saw during the pandemic. So, yeah, I love the question. It's wonderful.
Yeah, I think that was really something that got a lot of attention and got a lot of people seeing wastewater as a resource, a public health resource, rather than just waste, right? We often just don't want to think about it. It just goes where it needs to go and that's it. But it's actually a valuable resource of information, critical information. So as the pandemic eases, we're all kind of getting back to normal now. What are the next priorities for Kando as a business?
Yeah, I liked the point you just made also about, wastewater and then a resource. And, in many ways, I think, we as a business are asking ourselves a question a lot of people are asking is, should we even call this wastewater? Is the name even right? But I think that points the way forward for us as a business, but also the sector in general. So I think moving forwards, there is increased investment at the moment in our sewer systems and our wastewater infrastructures. And a lot of that is geared around some of the big challenges that we face as society. So challenges like water reuse, we've talked about public health, the degradation of municipal infrastructures as well. These are really big problems that we're facing. And so I think there's a lot of optimism and dynamism in the industry at the moment around, how we can have these kind of innovative breakthroughs that will allow us to sort of move to the next chapter. Perhaps, as I always say, bring our Victorian sewer systems into the 21st century. So the concept of smart water, smart sewer systems, these are no longer dreams. These are really real and achievable and tangible goals. So for us, we see our job as kind of facilitating a lot of that dialogue. We see our role very much in the space of enabling utilities to connect their resources and their data to the big societal problems, helping them understand how things that can be done in the sewer network, the kind of data that you can extract from the sewer network, how those can actually help and lead to healthier, happier communities, for example, And so we're looking at things like water reuse. That was a big theme. We're looking at public health. We've talked about that. We're looking at the way in which cleaner water can support potable reuse. We're looking at question of resource scarcity, circular economy. Those are sort of the big questions, the big challenges. And that's exactly where I think that we see ourselves. So, we're in the middle of a digital revolution in the water industry. Kando is very much part of that, and I think we're very much part of the sort of journey to not just using data for operational purposes, but using data for much broader purposes, and really, positioning the wastewater industry as part of that sort of ecosystem of solutions to big, broad societal challenges that we have.
That's really exciting. It's really interesting to see how it just beyond COVID-19 and beyond that, this is really something that can be useful to businesses, to policymakers, to anybody looking to see like very useful data and information about public health, about a whole broad range of water-related issues. So that's exciting. That Kando is looking towards that. We've spoken before, and in a previous conversation, you mentioned about a public health index based upon wastewater intelligence. Can you tell me a little bit more about that?
Yeah, I think that comes back to some of the previous points we were just covering in terms of what we did during the pandemic and the kind of insights that we were able to provide for COVID monitoring. And I think, broadly speaking, the wastewater industry as a whole, and Kando in particular, were able to show that the kinds of solutions that we bring can actually answer really specific policy questions about COVID. For example, how many people have COVID? We never actually knew how many people had COVID from testing data, because people don't get tested, they're asymptomatic. Actually, it turned out that the most reliable, accurate source we had was wastewater data. So these are real policy questions, they have a real impact. So we were able to show that. Now that was just for COVID. But once we get out of the pandemic and COVID hopefully is somewhat behind us, we're starting to turn to the question of other health challenges. So we've lived with flu for many years, but we have all sorts of other viruses. The big ones are things like RSV or enterovirus or norovirus. I could start going down a very technical list of viruses, but I think everybody who has a family, everybody who is sort of a relatively mature age has had experience of one or other of those illnesses. And the point is that for individuals, those things are really bad. Getting flu is a fairly sort of unhappy experience, or norovirus or anything else. But if you put those things together, they actually pose challenges to public health systems, so our communities. So in the pandemic, what we saw was that hospitals became overwhelmed. So coming back to the public health index, what we are trialing is the concept of putting multi-pathogen monitoring. So not just one virus or one pathogen, but monitoring a lot of pathogens, putting those together, and then using our data analytical capabilities. That's where we get into our sort of fancy AI and machine learning. But to be able to say, right, together in this community, the public health index is at this level or this level or this level, a little bit like the pollen index, and it can actually provide real guidance as to what the challenges might be in that community on a daily basis. So not too far-fetched, but think of it a little bit as a kind of health weather forecast. These things are coming, and you're likely to encounter them in your community. So that's a really promising, very active piece of work that we're doing, and we're really excited about that.
Yeah, that is exciting, and I think what you were talking about there about how wastewater can provide information that would be impossible to gather practically, if you went around trying to test every person or do surveys of every single person in a city, for example. And also something we've also discussed previously is that this data is anonymous as well, so that helps a lot with issues of privacy and stuff like that. So it's really exciting what you're doing, and the public health index sounds like a very good idea. Can you talk about a case study that you're doing at the moment, somewhere where you're implementing these ideas in your real life?
Yeah, and that's again, I love the question. Thanks for asking me to, give a couple of examples, because, sometimes this sounds a bit sort of theoretical, and people say, well, that's a nice vision, but we are actually currently trialing solutions in a couple of places in the United States. So, for example, we're working in a large Midwestern city to actually look and see how we can connect wastewater data to citizens' public health behavior. And the core of that work right there, and I love the premise of what we're doing, and we're working with the Department of Health, and I take my hat off to them. What we're doing is we're trying to see if citizens will trust wastewater data in a way that perhaps they didn't trust some of the COVID data or some of the vaccination data that came out during the pandemic. And that touches exactly on the point that you just made about, it's anonymous data. It's data that you can't identify any individual. I don't want to get into the technicalities, but there's no DNA, there's nothing individual that you can actually detect in the wastewater. We literally detect the virus, not anything to do with individuals. But the fantastic part of it is it's unobtrusive and it's relatively cheap compared to testing. So just as you said, it's not feasible to test everything, everybody for everything. But actually, from the wastewater, you can get this really sort of complex, rich, accurate portrait of what's happening in that community at that time. So what we're doing in that city is we're taking it out into the communities and working with communities, working with the public health authorities to see if we can help shape better health behaviors on the part of individuals. So that's just one example. I'll give you one more example very quickly, which is we're working in a large southwestern city. We're working there with the utility, with the public health authorities, with local stakeholders. And there we're trying to see whether we can address one of the problems that came out of the pandemic, which is helping businesses stay open when you have big health challenges, like COVID, or but it can be anything else, right? When we're sick, we don't go to businesses, we don't go to restaurants, we don't go to bars, we don't go to shops, and that poses challenges from a business perspective. And so we're trying to work and see if the kind of data that we have can help inform the business community, the public health community, and just generally improve the business resilience, I think, in the face of public health challenges. So yeah, really exciting projects for us, and I look forward to being able to talk about them at a future date.
Yeah, and it really seems like they're setting a precedent as well for future research and for future implementation. And yeah, it's really great to see that projects like that are underway on the ground, and also working with communities to bring about positive outcomes, which is what this is all about, isn't it, in the end of the day? So perhaps on a last note, Andrew, are there any other developments that you'd like to share at Kando?
Yeah, I mean, we've talked a lot about public health, and obviously that's a really exciting area for us. But I don't want to neglect the fact that, we are we are an environmental sciences company. Pre-pandemic, our core business was in pollution monitoring and networks. And we've got really exciting plans to broaden and deepen the kinds of products that we that we have that are built around the concept of wastewater intelligence. So, for example, we're adding new features to our existing Pulse product family, and we're also developing some really exciting partnerships, I think, across the industry. And that's another thing that I'm really sort of upbeat and bearish about, is that sort of bullish about, sorry, that I'm really excited about the kind of partnerships that we're developing as other businesses, businesses in slightly different areas than us. They're seeing the value of the product suite that we have, and they're coming to us and they're saying, can we work together to address these big problems that utilities have? I'll just give one example of that. So we are now part of the AliAxis Next innovation ecosystem. And so, there we work with a portfolio of existing and innovative companies. And we're very actively exploring synergies across that portfolio. And we're developing some really exciting impact metrics, for example, that can link together that portfolio, and we can present it in a very clear way to stakeholders, but to the public, exactly what value that ecosystem brings to our communities and to our businesses. And then of course in the field of public health, I've talked a lot about that, but we're working with some really exciting companies there, some companies that have some very unique insights from the world of public health data. And we're finding that joining the kind of data that we bring from the wastewater environment, the kind of data that they're bringing from the public health environment, that we can, again, expand and increase the value that we bring to the public health community. So, I'm really excited about those partnerships, but I'm also really looking forward to, the market meeting our expanded and enhanced range of Pulse products.
Yeah, definitely. It sounds like you've got a lot going on. And I'm glad you highlighted as well that, Kando, I've become quite famous for working during the pandemic and COVID, but you guys have been working for years on extracting data, information, and valuable insights on wastewater. Wastewater intelligence, I think, is what you call it, isn't it? So that's great, and I can feel your enthusiasm, especially for building partnerships, working with the community. Where we're sitting now, it seems like there's a lot in the works and a lot to work towards and a lot to be excited about, really. And I think in general, this space is one of smart water, one of smart sewers, smart wastewater. Just using digital tools to unlock valuable insights is really a space to watch. So Andrew, just on that note, we could talk for all day really about this, but I just want to thank you for joining me today and for coming on to H2O Stream to share your insights around wastewater intelligence and public health, and just showing our viewers out there some of the work that you're doing in the States and your plans for the future. I look forward to chatting to you again, and thank you so much for coming on today.
Well, thank you, and I really appreciate just the chance to have this conversation. It's a great chance for me to connect with you. Love the work you do, and we will look forward to coming back at some future date, and just having another conversation about the kind of progress that we've made in some of the areas that I've outlined. So thanks ever so much.
Definitely looking forward to it. Bye now.
Bye-bye.